So my topic is the symptoms and treatment of breast cancer. So first I'll start with the symptoms. Most breast cancer is discovered before any symptom is present, and this is by way of a mammogram in which abnormalities are found, or the actual presence of a lump that does not go away. And this lump can be either in the breast itself, in the armpit, or in the area above the collarbone. Some symptoms that are not directly correlated with breast cancer, but if they appear could be cause for concern, um, are include discharge, nipple inversion, or changes in the skin of the breast. My mother was diagnosed with breast cancer last year. They found it during a routine physical. They found a lump in her breast, and when she got her mammogram results, it was stage 3 breast cancer. So once the cancer is diagnosed, surgery is generally the first step. So the type of surgery needed depends on the size of the tumor and the kind of tumor it is, and also on the woman's health and her preferences for receiving care. So my mom had a right breast lumpectomy, so they took the cancerous tissues as well as a surrounding area of the normal tissue. And additionally, they extracted 12 of her lymph nodes, which are the glands in her armpit, because the cancer had spread through 7 of them. So this type of surgery is not curative and almost always should be done in conjunction with other therapies such as radiation therapy or chemotherapy. So chemotherapy treats the entire body. It's the administration of medications that kill the cancer cells or stop them from growing. This therapy is usually administered through an IV in cycles, and each cycle includes a period of intensive treatment lasting a few days or weeks and followed by a week or 2 of recovery. But there's also some chemotherapy that can be given in pill form. The side effects of this treatment vary depending on the type of drug used, but the most common side effects include hair loss, nausea and vomiting, loss of appetite, fatigue, and a low blood cell count, which makes your body more susceptible to infection because it suppresses your immune system. So there are additional medications that you can take to suppress the side effects. So during chemotherapy, you're usually on a host of other medications for the side effects. Following chemotherapy is radiation therapy, and this is a localized treatment. So that means it'll only work on the tumor cells that are directly in its beam. So it'll beam right directly into the breast, as opposed to the chemotherapy, which treats the cancerous cells throughout your body. So this therapy is used to kill tumor cells if any remain following the surgery. And it's most often used in people who have undergone a lumpectomy. Treatment is painless and only takes a few minutes. It's usually administered 5 days a week over a period of 5 or 6 weeks. And unlike the chemotherapy, radiation has very few side effects other than skin irritation in that area, which can be similar to a sunburn. So following her lumpectomy, my mom received 2 cycles of chemotherapy, one consisting of 2 different types of drugs administered over a period of 4 sessions, and the other consisting of another type of drug administered over a period of 4 sessions. So when she finished her chemotherapy, which lasted the better part of the year, she was allowed a month off with no medication until her radiation treatment started, and she received 6 weeks of radiation at a rate of 5 days a week. So many advances have been made in the diagnosis and treatment of breast cancer, so much so that breast cancer itself is no longer a death sentence, and my mom is living proof.